Hey guys, how are you doing? I hope you're having a great week, and welcome to another episode of A Taboo Life, where everyone has a story to tell. I'm your host, Drew Franks, or Frank for short. Come check out our website, ataboolife.com, where you can read some interesting articles, such as the article which pertains to this episode, You Should Stop Mumbling and Enunciate More, Life with a Speech Impediment. And also, there's a little fun article I wrote, which I really love, and it's raunchy and politically incorrect. It's called Nice Hair / Leg / Hygiene. How to Flirt by Using Stereotypes. Check those out. They're free on the website. Among other short stories, articles, and books, and other episodes. Again, it is at ataboolife.com. Today's guest is Miss Marissa Artman. She is a speech therapist here in Florida and Georgia. She has her own therapy service, which is called Linguabilities LLC. It's an online service, and her website link will be in the description of the episode. So if you guys want to check her out, obtain her services, it'll be on the bottom of the description. The reason why Miss Marissa Artman is doing today's episode, because I obviously have a speech impediment. I sometimes don't enunciate. It's something that I had to deal with most of my life, so I thought it would be a good episode to actually try to stop the stigma of having a speech disorder, because it is really rough to talk and do public speaking and constantly worried and be self-conscious about your voice. So this is a great episode, and I learned a lot about it, especially how broad the field is for speech therapists to actually do a lot of work, and the different stigmas and different disorders involving speech therapy. So I hope you guys enjoyed the episode, and here it is. Right, we're live. Alright guys, I want you to welcome Miss...
Hi, I'm Marissa Artman. So I am a speech language pathologist, and I run my own business doing teletherapy, which is online speech therapy. And I have done a lot of different types of speech therapy in person, working with kids and adults and all that sort of stuff. But right now that's my main focus. So I'm here today to talk to you about all things speech therapy, and we'll see where it goes.
Yep. The reason why I'm doing this episode, because I do have struggles with my speech impediment. I had it. I was left back in kindergarten because I had really bad speech impediment, and I had to see a speech therapist all throughout elementary school and middle school. So I thought this will be a good episode to have someone like you, who's an expert in this field.
For sure.
We'll talk about your side of it, and the stigma behind it too.
Yeah, definitely. I think that's what really drew me into wanting to talk to you, because I think there is a big stigma still for a lot of the speech disorders and the unseen disabilities out there. So, I wanted to talk a lot about some of that stuff.
Yeah. There have been like famous people that had speech impediments, but you wouldn't really know. Mm-hmm. I would say like kind of my favorite example would be Rowan Atkinson.
Oh yeah,
Mr.
That's
Bean.
A good one. I love Mr. Bean. I use him in therapy all the time because he doesn't talk that much, right? So he's really good with using his body language to show you what he's doing. So he's great when I'm teaching kids social language things. And I say, so what is Mr. Bean showing us with his body? Because he's not saying anything that we can figure out what he's feeling.
Yeah.
And yeah, I know that there's plenty of actors like James Earl Jones and Emily Blunt. Yeah. That, you know, they may have had some, like, stuttering, or Ed Sheeran had stuttering. Yeah.
Oh, shit, like, that's weird that they had that, because you would think, especially James Earl Jones and Ed Sheeran.
Yeah, absolutely. Some really famous, like, really successful people in acting, politics, all walks of life have had speech disorders. So, I mean, it just goes to show that, like, it affects all people. You know, all walks of life, all ages, everything. And so I think it's good to talk about that, like, speech is... When we talk about speech, I wish that we had a better term for it. We call ourselves speech language pathologists, and everybody thinks that we just treat teaching kids how to say R, or
the TH.
Yeah, exactly. Or can you fix a stutter? Like, yeah, that's part of what we do. But also, SLP is like short for speech language pathologists. We work in hospitals. We work in VA clinics. We work in NICUs with tiny little babies who come out prematurely.
Wow.
Yeah. We come work with people who have traumatic brain injuries and need to relearn how to speak or have had a stroke. Oh. We work with people who have throat cancer and need to learn how to use
the voice
device.
Box.
Exactly, yeah. So there's a whole range of things that we do, including swallowing. That's not my area at all. But there's, you know, speech is not just talking. It's the whole realm of communication and what the head and mouth and neck do. So, I wanted to come and talk about, like, hey, speech is more than just talking. It's a whole thing.
Well, like I said, like, I have my experience with it, but I didn't know it was in that depth too. Yeah. Like, it was how wide it branches out.
Absolutely.
The swallowing part, like, what does that entail? Because I never heard of that.
Yeah, so swallowing, the disorder is called dysphagia. And that can happen for both kids and adults. It's basically when something happens with your system in your mouth, tongue, throat, anything before you get to, like, the esophagus, where it's not working properly for you to eat. So maybe you're having difficulty, like, keeping the food in your mouth, or using your tongue to bring it around to the back of your mouth, or when you actually swallow, you have a little bit of food go into your airway.
Oh.
There's a lot of different parts where it can go wrong. And so we check on making sure that all the pieces of your mouth are working properly in the right way that they should. And then we can do some actual, like, standardized tests with, like, modified barium swallow studies using an x-ray machine with a radiologist to see, using a little bit of barium, and you, like, swallow some pudding.
Yeah.
And we can see actually where it goes down. Is it going in your esophagus, or is it going in your trachea? So it's pretty cool.
So, because I know that's a automatic nervous system, right? When you actually swallow.
Yeah, like, once you initiate the swallow, it just does its thing.
Yeah.
Yeah, you're not doing anything after that. But the body sometimes, it doesn't coordinate quite right, the timing of the swallow, or you may have too big of a bite that you tried to swallow, or you may have a little bit of, we call it premature leakage, like it's kind of rolling over the back of your tongue kind of thing. So there's a lot of coordination that goes into speaking and swallowing that we don't think about. It's a really complex thing we do. And that's what we look at. We screen that, we assess that, and then we treat that when any part of it goes wrong.
Wow. And you said the other fields you do would be like VA, helping out with veterans, and hospitals. Like, what would you do in the hospitals?
So hospitals have a range of things they can do. They, working with the babies, if a baby is in the NICU and is a preemie, like, they may need some help with the learning how to eat, the dysphagia part. If you have people who are adults, you're probably going to see a lot of stroke patients. They may have what's called aphasia, where you have a loss of language in the brain. Mm-hmm. So it's not that you have a loss of intellect. It's a specific part of the brain where language really is held, that if blood flow is cut off from this part of the brain during a stroke, then you lose a lot of that capacity. So speech pathologists come in the hospital and assess, oh, okay, this is what happened with the neurologist to your brain. And then we say, okay, this is your diagnosis of this type of aphasia. Is it Broca's aphasia? Is it, Wernicke's aphasia? And we work to figure out what your deficits are and what we can help you with. We can also see gunshot victims. You might have gotten shot in the throat.
Ooh. Or
burn victims. I know that can affect their throat. So there's really like a wide capacity of things you can see. At least that's what I saw when I was doing a rotation in the hospital. So there's inpatient hospital, which is like seeing people in beds on a daily basis. And you'll see a lot more like strokes and swallowing there. And then there's outpatient, which is where people would come on a weekly basis and see you for therapy, working on goals toward trying to get better, but they're a little more stable.
Because I had a question that just slipped my mind. Sorry, had complete brain fart.
It'll come back.
So, how would you treat like victims like that? Not victims, but patients like that, mm-hmm. that have fire or a gunshot wound?
So the first thing the hospital would want to do is have the doctors stabilize them, mm-hmm. make sure that they're safe, they're not going to be going into shock or whatever, that they're comfortable and have the blood that they need and all that stuff. So once they're stabilized, then we would come in. I think one piece that's really missing in hospitals is that other staff don't know that speech is there. Mm-hmm. So it's important for speech therapists to advocate for themselves, to say, hey, we are a resource that's available. We can help you with this. And then we would go into, at the very least, screen and see on a yes, no basis, is anything wrong? Kind of like a pass-fail.
Okay.
And if it was a fail, then we would do an evaluation to look more in depth to see what's going on with this person. Like, okay, well, you were in a house fire. What's going on with your vocal cords? Do you have damage to them? Is it making it hard for you to speak? Do you need some kind of assistive device right now or for the long term? Mm-hmm. And looking at that. And then we could talk about therapy and what the goals would be.
Okay. What is the most common, what's the word would be, diagnosis or common ailment of speech therapy speech pathology that you take care of?
For me, I don't know that there's one for the entire field, because mm-hmm. there's a huge range, right? For me, the most that I've worked more in the school settings. Mm-hmm. So I've seen a lot of kids with learning disabilities, kids who have difficulty with speech sounds, kids who stutter, kids who might have problems with social cues and autism. So it really just depends on the setting that you're working in and the age group. That's the beauty of speech, is that you can work from birth to death. It's the whole range of life. So depending on where you want to work, it's going to make your percentage of what you see a lot different.
Yeah. For children, will you say stuttering is mm-hmm. the biggest problem, or is it mumbling?
Stuttering, not so much. Actually, stuttering only happens about 1% of the time in the population. I think it gets overblown in the media as being something to easily latch onto. Mm-hmm. So I don't see as many kids who stutter. I see a lot of kids who are working on speech sounds like R and S. Mm-hmm. I see some kids who are working on language goals, maybe they don't quite have the irregular verbs of when we say run, ran, we don't say run, runned. Also, it can go into reading. So it overlaps a little bit with teaching, and you have to work in collaboration with the whole teaching team, like the parent, the teacher, special educator, everybody that's on board, right? So we might look at, is there anything in speech as far as like your vocabulary, your phonological awareness, your understanding of figurative language that is helping you or hindering you from reading? And then we can go into reading comprehension and reading fluency and all that stuff to help them, read to learn. Because once you have mastered being able to read, then you're going to be able to go read a million subjects and teach yourself whatever you want, right? So we can do writing and all sorts of things. I also work with some older kids who are working on social skills and like executive functioning. And nobody knows what I'm talking about when I say executive functioning.
It means like higher order thinking, right?
Exactly. Yeah. Very good.
Yeah, there we go.
So like problem solving, planning, flexible thinking, that kind of thing. And honestly, I think like more people than not could benefit from it. Like if you're a high level executive, you could benefit from flexible thinking or being able to manage your time more effectively or something. Or
abstract thinking.
Exactly, yeah.
Empathy.
Yeah.
You said that you also do nonverbal cues too. What does that entail? Like you have to actually teach kids how to read people and then also how they do their body language too? Absolutely.
So for kids who have autism in particular, there are some other disorders that have trouble with the social cues too, but specifically autism, they don't pick up on those social cues that we may have just learned kind of in looking around. And so mom and dad didn't say, hey, look people in the eye when you talk. But for these kids, we may actually have to directly train that.
Oh, wow.
So we break it down into little discrete parts to say, here are the body language cues. This is why it's important. How do we make friends? And, we built it to whatever is important to them, whatever they want to work on. If making friends is really important, this year we can work on that. Or maybe next year it's like figuring out how to ask a girl out on a date. We can focus on that. Whatever is age appropriate, So there's a whole spectrum of things you can do.
Wow. Like I said, earlier, really was not aware how broad your profession is. Like, there's different fields, not fields, but different branches that you guys do.
Yeah.
How did you get into this?
So I started in music, oddly enough. Yeah.
It's a language.
Yeah. It's a different language, yes. I wanted to do cello performance, and I studied cello for about 10 years, and then didn't get into cello, didn't get into the music school, which turned out to be a blessing. I think that was just not meant to be. And so I went to the same school anyway. It was part of the same school in Indiana, and I was looking for something that allowed me to combine a love of helping people with science and also something that really interested me. So I started out with psychology. I thought that might be something interesting. I fiddled around a little bit with linguistics, study of language. And then really what piqued my interest at the end was speech pathology. I thought how we use language, how it's diagnosed, how it's evaluated, how we can treat it when it goes wrong. That's really what I want to focus on.
Wow, so I'm trying to remember, you have a master's degree in it, right? How long did that take?
So to get that, you have to go through 4 years of the bachelor's, right? And then 2 years, it's 2.5 of the master's.
And that, you have a, what do you call it? Not tenure, right?
That certificate?
Not just when you have to actually train underneath someone, what doctors do?
Yeah, so you have a clinical fellowship year.
There we go.
Yep. After you finish grad school, you have 1 year where you have to train under somebody. So you are a licensed SLP, but you don't have your C's. That's like the golden, I've done it, of speech pathology. And so you're working under somebody who does have their C's for that year, just to get a little bit more guidance and, polish off all the rough edges on training. And so you do that for a year, and then you're off on your own and ready to go.
Okay. What typical cases do you usually handle?
Me personally, or just in the field?
We'll start with you personally.
Me personally, so I've done quite a bit. In owning my own business, I've mostly worked with kids. Mm-hmm. I do a lot in schools. I started out having to hodgepodge together some jobs because that's just what the market was, right?
Yeah.
I started my own business up in Chicago, 4 years ago. Mm-hmm. And I pieced together there, owning your own business is almost more a hodgepodge itself because you have to find different contracts with schools and outpatients, and, it's never like a consistent, this is what my day is going to be. It's like, what can I find to pay the bills? Mm-hmm. So I took adults, I took kids, I saw people in their homes, I saw kids in schools. I also took kids who didn't quite qualify for speech, but we worked in like a tutoring capacity. Mm-hmm. So I tried to make it work with all the things I could do.
Okay. Well, I actually thought about this earlier. What kind of exercises do you normally give to people?
Oh, that's a good question. So one thing I think people think is, maybe I don't need to see a speech therapist. I can just teach myself with YouTube, right? There's a ton of videos out there that show you, like, here's how you can say ass. And those are great. Totally look at those mm-hmm. and see what's going on with them. But, like anything you're practicing, you want to make sure that you're actually learning to do the skill correctly. So if you learn to say that ass incorrectly and then practice it wrong, you're not really going to get anywhere. So the point of coming into speech therapy is to figure out, how are you producing whatever it is that you're doing differently? Language, speech, whatever. And then how can we adjust it to make it better for you specifically? So let's say for a kid that's working on R. R is a really fun one because it's a weird sound that can be fixed in a couple different ways.
Like, because I'm trying to think of different R's.
Well, like you might come up with wabbit.
Rabbit, yeah.
Yeah, that's a classic one.
I think it's also like a northern thing too, mm-hmm. like water and rabbit.
Yeah, we can have it on the beginning, like wabbit. We get that kind of cutesy speak, like mm-hmm. Baby talk. And then we have that, the difference on the end where people might not say the R at the end of the word, so they say wada.
Water.
Yeah.
Water.
So water. Yeah.
Get to the car.
Yeah. And so that's an interesting point. Like that's a dialectal difference. And that's totally fine. That's not a disorder by any means.
It's just, the dialect.
That's just a difference in the way people talk. It's still English. Mm-hmm. It's still rule bound. It's still, part of what English is. So I'm not ever going to say, hey, you from Boston, I'm going to change your accent. If you want to change your accent because you're preparing for a role in a play, or you don't feel comfortable at work, mm-hmm. or from whatever reasons you have, we also do accent modification.
Is that what they call like the Midwest accent? It's like the same. That's why most actors and TV anchors got the same.
Yeah,
What's that called?
That's called the standard American English accent. So that like newscaster accent, that just like Midwestern nothingness. Mm-hmm. Yeah, that's like standard American English, mainstream American English. Then we have the little regions all around. Like we have the New Yorker accent, we have the Southern accent. There's many little pockets of Southern. Yep. We have the Chicago, which I started to pick up when I was living there. I got the little and so we have these little regions, and they're all colored by where people came from in different countries, right?
Mm-hmm.
But the kind of melting pot, I guess, of the mainstream American English is that kind of newscaster sound that people just find.
Walter Cronkite accent.
Yeah. So it's not, I don't want to call it what you should want to sound like at all. If you want to sound like that, cool, do it. But that's just like what we've considered normal. I don't think it is, normal's not the right word. That's just kind of like the universal, this is what everybody takes as the norm.
Mm-hmm.
So that's what we go for generally when we're teaching accent modification. And this is true for like people who might come from other countries and are having difficulty getting jobs because of their accents too.
Yeah. Say Indian.
Mm-hmm.
What was somebody else I was talking to? Middle Eastern, like with the Farsi language.
Mm-hmm.
Because a couple people I did talk to, like they sound really like they know the words very well articulated, but just the pronunciation.
Yeah.
There we go, pronunciation.
Yeah.
Is off a little bit.
Yeah, it's there's that. It's like a window where up until about age 11 or 12, your brain is pretty plastic for language.
Mm-hmm.
So it's pretty squishy in that you could take a different language and learn how to say the different accents really well. So if I took you at age 8 from America and plopped you over in China, you would probably be able to pick up the Chinese accent pretty decently. But if I did that when you were 30, not so much.
No.
So that's the problem that people have, like that window is gone. That brain is so like firm in what it's learned in its original language that then it doesn't have the flexibility anymore to be able to figure out, oh, this is how the other sounds work in other languages, how the other words and the grammar works in other languages, so it's really difficult to learn the other ones.
Now, for speech disabilities, what would be like the common reasons why people have speech disabilities? Like, will it be overbite, something in the brain?
There's tons. So we put them in two major categories. There's either something that is traumatic that happened. So you were born a healthy, happy baby, and then something happened. That's a traumatic event. Or it's something developmental in nature. So we don't know maybe yet what the diagnosis is, but something along the way in your development as a young child caused you to have a speech and language disorder. So the difference, for example, in a traumatic one is like a stroke or a brain injury or a gunshot wound. The developmental ones would more be like a structural difference, like if you have, your teeth are in the wrong place, that can be fixed with orthodontia. Or you have a learning disability, or you have stutter, or anything like that.
Okay. So this varies.
Yeah,
basically.
It really does, yeah.
Oh yeah, go back to, we went down a little rabbit hole. Like, what exercises would you suggest for people? Like, not besides the YouTube. Like, some exercises I still do is I stretch my jaw, and then I do the A-E-I-O-U, and she sells down out of she sells down.
Tongue twisters,
Yeah,
right?
tongue twisters.
I don't know that I could give you a specific general list of exercises to do, because it really is so individual. And that's what we strive for in our evaluations and therapy. We want to make it specific to the person.
Now, like I said, growing up with a speech impairment, I was able to get over it by forcing myself into like social situations, into public speaking. So I had to force myself into that to actually overcome it. But also know there's a stigma behind it. Like, what stigmas have you seen with speech therapy?
I think
not speech therapy, but with someone with speech impairment.
Stigmas, yeah. I think we've come a long way. So way back when, we used to have cases where deaf kids were put in schools and not allowed to sign at all. And they were
Really?
wrapped on the hands and taught to only speak English. I mean, imagine not being able to hear anything and trying to learn to speak. And we have, cartoons about, you look at Porky Pig or, any of these other cartoon characters that have weird speech patterns, and they're just kind of part of our culture.
Mm-hmm.
I think we've kind of gotten away from using them so much as it being funny. And I think we're getting better at realizing that having a speech difference does not mean that you're stupid, does not mean that you're bad in character. There's still a little ways to go, though, because speech is such a unseen disorder. Same thing for mental health, chronic pain, that whole category, because you don't have a big sign over your head that's like, hey, I have this, like somebody who might be in a wheelchair.
Yeah.
Which is good on the one hand because you can choose to disclose that if you want. If you have an issue with reading, you don't have to be like, I have an issue with reading as soon as it comes up in conversation.
Mm-hmm.
You can just keep that to yourself. But on the other hand, because it's so silent, then sometimes people don't take it as seriously and they just brush it aside. So I think what we're working on right now culturally is to acknowledge that, like, yes, these things are still there. There are differences in people. And that's okay. Like, people are different, right?
Yes.
So play to your strong suits. Like, I am terrible at math. Always have been, always will be.
Most of us are.
That's why I went into a field with words. And what I always try and, like, relate to my clients on some level of what their strengths are rather than what their deficits are.
Yeah, because one thing I noticed too, and one thing I noticed, like, from growing up, I still do it sometimes, there's a lot of times I'll be afraid to speak up. Mm-hmm. And I get scared about it, like, especially when I talk to, for example, say if I want to flirt with a pretty girl, mm-hmm. I actually have to plan what I'm saying.
For sure.
Like, not so much the pickup line or anything like that,
yeah.
but like, all right, how am I going to pronounce this?
Yep.
Don't try not to stutter, and I know I'm going to stutter. It still stutters.
You get nervous.
You get
yep.
nervous.
Yep.
And it's just hard. And most of the time, I think the girls think it's cute, but like, it's someone probably with a worse speech impairment. Mm-hmm. It's probably more daunting to them too.
Yeah. Yeah. Like, we all have our own levels of what we think we're good at. We all have our own strengths, and I think it's fine to say, this is difficult for me. These are the strategies that I use, and to be more open about that. I don't think we should, like, hide in the shadows of saying, like, you know what, when I read it, I need to put my finger on the page, or when I talk to somebody, I need to prepare myself to talk about what I'm going to say, or whatever. For example, like, I struggle with anxiety, and mm-hmm. I don't always disclose that to my clients, because it's about them, not me. But if a student or a client is having some difficulty, especially like with a social situation, I might say to them, you know what, I get it. Like, I understand how sometimes it's difficult to go up to a group of people and say, like, hey, can I be with you? Can I hang out with you? Mm-hmm. So I try and relate to them on, like, just because I don't have what you have going on, there are other people out there in the world that understand the same sort of struggle you're dealing with. So connect on that level.
Yeah, it's like, it's kind of like looking at a mountain and you see two different trails and you see two different challenges. Like, mm-hmm. your challenge, like for your examples, anxiety, mm-hmm. and some with your client's client's challenge might be the whole stuttering part. Mm-hmm. So same mountain, but two different trails to go up to.
Absolutely.
Or two different challenges.
Yeah.
Sorry, I keep getting brain fart today. It was a long day at work. With dealing with clients, how long do you usually take with them? Like, what would be the process of helping out your clients?
That's a good question. So screening is pretty short. That's 15, 20, 30 minutes, something like that. It's just a quick and dirty, do I need to evaluate you kind of thing. An evaluation is going to be a little bit more in-depth. That's going to take 2 hours or so to see what's going on with an area that we want to talk a little bit beforehand to say, like, okay, what are you worried about? Are you worried about the way you say sounds? Are you worried about swallowing? Are you worried about looking people in the eye and having conversations, so that I don't just bring a random test and we pick the wrong one? But that'll take, give or take 2 hours. And that you write up a report, and you take a combination of like standardized assessments and talking with the person, your clinical judgment, any background stuff like medical history, and putting it all together in like a big holistic piece to make, this is the person, this is what's going on with them. Then you can decide, okay, this is what we should do for treatment, because that really drives the treatment plan. And you work with the client to say, okay, what do they want out of treatment? It's not about me, like, well, I think, okay, I see these areas of difficulty, but if them learning how to use a calendar is not important to them, I'm not going to teach it. So if they want to work on something else, we're going to do that. So you can then decide, like, if you're going to meet weekly, monthly, more, whatever. The frequency and the relationship really depends on you and the client.
Okay. Sounds like a typical therapist, too.
Yep.
For stuttering, because I know I have this problem sometimes, what would you tell a client how to overcome that?
I'm going to focus on things I would tell people to not say.
Okay.
So some myths about stuttering are that it's all about you're nervous. It is not about being nervous.
Really?
Yeah.
Because I know it's like I stutter a little more when I'm nervous. But
sure. It's related.
It's related, but it's not the cause.
Yes. It's not about because you're nervous, but being in an agitated state and you're anxious is going to make it worse, yes. Telling somebody to slow down is an oversimplification of what needs to happen. Just slow down doesn't make any sense. Like, that's like saying, just stop thinking about something. And then your brain's going to think about that one thing, right? So instead, you could, focus on using strategies like take a minute, think about what you want to say, ease into your words, use your good breath support so that you make sure that you're not starting on there's no breath kind of thing. So those would be some strategies for stuttering.
Okay. Because I'm trying to go over kind of like the big impediments I know about, like the stuttering, enunciation. What would you say for someone with enunciation problems?
The big ones we see for articulation and phonology, those are kind of hand in hand, are kids working on like R and TH and S.
SH.
Yeah, and that's all about tongue placement. So it's really figuring out where your tongue needs to go for a particular sound. It's something about the way in which your brain has learned that this sound is mapped to a particular place in your mouth, and it's just misplaced it. So some kids have misplaced wabbit for rabbit. Yeah. And you have to retrain that so that whenever that R comes up in that context, you have to use that R sound instead of a wah.
Wah.
Yeah.
For mumbling, like someone who is a low talker or doesn't open the mouth or the lips the whole time, how would you help them with that?
That one's kind of related to the stuttering too, where you want to have good breath support. You want to make sure that you are priming yourself well so that you don't start with like a low volume in your lungs and just kind of run out of air. You also might want to try hyper-articulating. So that means hyper is like extra, and then articulating is the movement of the mouth.
Yeah.
So you might want to over-exaggerate what you're saying. It might kind of look silly or sound silly, but if you're somebody who is mumbling, it might get you to that level of sounding normal. Mm-hmm. You also might want to play around with volume, pitch, different voices even. Like, stand in front of the mirror and play around with different voices, like impersonate somebody and just like see what your voice sounds like, You don't have to go out in public and be that person, but just being a little bit more comfortable in what your voice can do and then trying it out in small capacities in public places, maybe starting with family, then broadening it to a church outing, and then if you had to do a public speech, that could be your, finale. Mm-hmm. You build on that.
Okay, cool. What other major diagnoses are there?
The major ones, we touched on autism, and that's a big one because it's increasing in frequency.
Well, I remember when I went to college, we were talking about that. It said there's a higher rate of autism, but my professor made a good point. He said, like, that might not be, the population might be the same. It's just we're actually diagnosing it a lot better.
It's a good point. Yeah, it's definitely, it's a little bit of both. Mm-hmm. So we're definitely diagnosing with better accuracy. But there is also an actual increase.
Oh, really?
Yeah. So both things are happening at the same time.
And the doctors don't know why that's increasing, right?
No, unfortunately, we don't. We have ideas that it's probably a combination of like genetic and environmental factors at play, but we don't know what those things are. We can't say, oh, it's these genes or it's these environmental factors.
And it's not from the shots you got from a baby, right?
No, it's absolutely not. I'm so glad you brought that up. I am here to say vaccines do not give you autism.
Wasn't it like 99.9% of doctors said no, and there's one doctor said yeah?
Yeah, it's from one study that the doctor falsified his results. And then he had his medical license stripped from him.
And Jenna McCarthy was like, oh my God.
Yeah, and then it just got blown up in the media, and people have kind of taken it as this alternative medicine, thing to latch onto. So I'm not saying that you have to just, like, believe every single thing that what the mainstream tells you.
Yeah.
Do your research, for sure.
Well, some of it is just common knowledge, like, first of all, when's the last time we had polio?
Yeah.
It's kind of like, there's a reason why.
Work is like, it's a herd immunity thing.
Yeah.
So if you decide not to vaccinate your kid and they're perfectly healthy, then you're putting at risk the people who aren't. You're putting at risk the people who might be elderly and can't handle that illness, or kids who are very immunologically compromised and can't get the vaccine and then can get measles or polio or whatever. And so we're seeing actually an increase in these diseases. The World Health Organization has seen increases in diseases that we had
eradicated.
Basically eradicated, like a really low level. We thought we had a handle on, and they're like, guys, you need to start vaccinating more again. So, yeah. It's a tough one.
Yeah, it's a tough one, but there are real conspiracy theories, and there's some that's not, and that's not.
That is not one. No.
That is not one.
I'm going to put my foot down on that one.
Going back to the autism, you said, because the most common diagnosis, you said autism, and what will be the next one?
Yeah, autism is up there. I think, honestly, in the education setting, you're going to see a lot of kids who have learning disabilities and speech related to that. So maybe they're having trouble with language or reading because of their learning disability. In adults, it's probably going to be stroke related. Yeah.
I know that's a scary one too. One day you're fine, the next day you have to relearn how actually use a fork again, talk again, read.
Yeah, and each stroke is really unique, so we know more about strokes than we did, but the doctors can't say, well, here's your map, this is what's going to happen. They have to kind of figure out what's going to happen for you, and there's a lot up in the air, and I'm sure that's very frustrating for people going through that. Yeah.
For people who don't have a speech impairment but want to improve their, improve their speech, what would you suggest for them?
So speech therapists do work at the level of like executive coaching. We can do things like the accent modification falls into that because it's an elective thing. It's not a disorder. It will never be covered by insurance.
Oh, okay.
But, let's say that you're a C-level executive and you want to work on your presentation skills of, giving a pitch speech to somebody. There could be a speech therapist out there that specializes in, let's work on your presence of being out there on the podium. And what do you say? How do you hold yourself? How do you make your words more powerful? There are also people who will help you with like the social dynamics and the executive functioning. If people are struggling like at the college level and they just quite don't have that piece and they can't get their studies together, maybe they're struggling with getting deadlines done and I don't know how to study for this exam. Putting all those things together, we can help with that too.
Really? Wow,
there's a lot we can do.
Yeah, that's surprising. How would you help with that, though?
So that piece, again, it can fall into an actual diagnosable disorder. If you have perhaps, it's not called Asperger's anymore because they just changed it.
Oh, really? What did they change it to?
Now it's just called the autism spectrum. It's part of that spectrum. I, in my head, still call it Asperger's because it makes sense for me to just kind of categorize it a little bit more definitively as this group of people who struggle with social things but have, the very good cognitive skills. And it's more about, like, work life and social life and that kind of things.
Okay.
But also there's just people who, they may not have a diagnosis, but the pieces just aren't quite coming together. Maybe you have ADHD.
Yeah.
And that's not a speech disorder, but I can help you with the executive functioning part of making sure that you're getting your studies worked out the way that you want.
Well, I was just thinking when you mentioned executive function again, you think it's kind of like not a two-way street, but kind of like a mutual relationship, like if one's affected, the other one's going to be affected too. Like, say if you had, let's say, someone breaks your jaw. Like, you're doing boxing and someone gives you a nice uppercut, and you broke your jaw. You have to have your jaw wired shut.
Right.
Do you think there's a relation to that you might have a little problem with executive functioning, or is it just top down?
No, I don't think so much like that if someone broke your jaw, you'd have that. I mean, each person is individual, so I can't say, like, absolutely not.
Yeah.
But I think it would be more of a top-down kind of thing.
Top-down?
Yeah.
Okay. So, I remember sometimes doing these exercises, the diaphragm exercises. Can you go into a little bit more, give us a little example of that?
So, one thing I was working with a student the other day is belly breathing. And this is part of his work on not stuttering, just having a good support of breath. So, since this is a podcast and nobody can see us, I'm going to explain what we're doing. So we're sitting upright in chairs, and we want to make sure that we're not, like, slouched down. We have good posture. And instead of breathing from the chest, like in the shoulders, and having those shoulders go up, like that, we really want to focus on having the breath come out from the stomach. And so sometimes at least in American culture, we want to, like, hold that belly in really tight because we don't want anyone to see that we...
Hold the belly in?
Yeah, we want to have abs, right? That's not how humans work. We have stomachs, and it's fine. So if you let the air just naturally flow, like, think of it as a balloon. So you let it really just go. You're letting the diaphragm expand naturally. The diaphragm is that muscle that separates the lungs and the stomach in between, you know, the stuff in your thorax. So you're letting the diaphragm just expand naturally to let the lungs fill.
Okay.
In doing so. That's a much more natural breath where you're going to get more air in your lungs. And then when you let it out, you just kind of let the air out of the balloon.
Okay.
Yeah. Instead, if you did a tight breath where you did it up in the shoulders, you would get a lot less breath. Mm-hmm. You can feel it like right here.
Yeah.
And then you don't get as much out. And so you're more likely to start a bumpier sentence, to start with tension, to start just, you know, a whole slew of things could initiate that are not as good. And this goes for voice too.
Mm-hmm.
But so diaphragmatic breathing helps a lot of things.
I gotta start doing that again. Because when you did that example, I started to remember slowly how to do it. I'm like, oh yeah, I forgot how good that feels.
Yeah, it does feel good. You just like check yourself, remind yourself to do it. You're like, oh, that's what I'm supposed to be doing.
Yeah, it's like a good feeling when you get that oxygen in like that. What would you say is the biggest stigma when it comes to speech impairments?
I think it's still that if you talk differently, you're stupid. That's really sad because it's not true. I worked in Chicago on this aphasia support group. It's still there, actually, in Chicago. So if anybody wants to connect with people, you know, in aphasia, please go check them out. They're awesome.
Yeah. Well, you know the website or the...
Yeah, it's called Chicago Aphasia Network, or CAN. And I can give you the website for it.
Yeah.
And basically, like, for people with aphasia especially, but any speech disorder, because you sound different, people sometimes assume, oh, well, that person's dumb. And that's not true. Just because you sound different, that's not a measure of your intellect. It's just a measure of what's going on with your ability to communicate.
Yeah.
So we really have to separate those two ideas. And, I mean, you, like, look at Stephen Hawking, right?
Freaking genius. And,
yeah.
And for people don't realize, he was supposed to die a really long time ago.
Yeah, he lived an extraordinarily long time.
He had Lou Gehrig's disease,
yeah,
right?
ALS, right.
He was supposed to die 2 years after that diagnosis, and...
Yeah, I don't know what miracle drug he was taking, but...
I think he's just sheer will.
Like, yeah, like, I'm not gonna die.
It's like...
Yeah. But, so he had an amazing system of, we call AAC, which is Alternative Augmentative Communication. And I like that stuff. It's really cool. There's a whole, you know, it can be as easy as, like, signing with your fingers, or pointing to a picture, or having a computer do what Stephen Hawking does. So it's really just about, like, just because you can't say something with your mouth the way that I'm doing right now doesn't mean you're dumb.
Yeah.
That's the stigma that I think we need to get away from.
Because I was going to ask you another question, but I want to ask you a question about that technology. What different variations can you do with that? Like you said, the picture, or... Because I know the way Stephen Hawking did it was with his finger, right?
Well, I don't know if he did it with his finger. He had a lot of things that were pre-programmed.
Or his mouth or something like that?
He had a system that is not available to the public.
I think that was just custom built for him.
It was his custom built thing, yeah.
Because he needed it specifically for physics and equations.
Yeah. There's a lot of cool systems out there now. The technology has really come a long way. There's some good companies out there that are doing what we call speech-generating devices. And they're specifically built devices that do language and speech output. So they might be for kids who are nonverbal for whatever reason. You know, you have Down syndrome, you have autism, you have a tube in your throat, whatever, okay? And you might have the kid, you know, pointing to these words, and it's important to start them early because that's how they're learning language. If they can't get the words out, well, then they don't have the opportunity to learn their native language. Sometimes people say, I don't want to start a kid on anything with pictures or devices because I want them to talk. Mm-hmm. And the research actually shows that if you use AAC, it will help them to talk. It increases their chance of talking.
So like those, maybe like that old spinning toy, the one at the McDonald's.
Yeah.
The animal ones.
CNC.
Yeah. It, like the arrow will point to a dog, say, this is a dog. Woof, woof.
The cow says moo.
Yeah.
Yeah. So, like, you know, you might have this thing that the kid pushes the button and it says, I want milk. Or it just says milk. You can design it different ways, right? Mm-hmm. People sometimes are like, well, then it's just talking for him. But it's giving the kid a voice, which is really empowering.
Yes.
And it's also giving him models of language, which are really important, that he wouldn't otherwise have. And then it shows in the research and just in my own experience that kids, at least, who are using AAC are more likely to start playing around with their own mouths and language, who are delayed in language, and start using language a little bit more to go, oh, I might want to say milk. And then eventually the device might be used less or go away. You know, it depends on the person, but it's not always going to have to be there, but it's there for when you need it.
Yeah, it's kind of like crutches in a way.
Yeah.
Like you need it, like if you broke your leg, like you need the crutches for a little bit until you get better.
Exactly.
Also, too, like when you're talking about using an object or using a piece of technology to express yourself, that's also kind of like philosophical too. Like such like art, using art like painting or music, comedy or writing to express something that you can't articulate in speech.
Yeah, that's a good point.
Tourette's, because I just thought about that. Do you help people out with Tourette's?
I haven't myself.
What the field does too?
Yeah, I believe so. It's more of a neurological condition. So you definitely want to get referred to a neurologist.
Before we go on, can you like clarify what Tourette's is, just for the people who just may have a bad idea of what it might be?
Yeah, sure. So Tourette's is a neurological condition where there's some misfiring in the brain that sends signals that makes different tics come out, and it's not always speech things. So in the media, it's portrayed, because it's funny, as people saying curse words or, you know, blurting out things that are really inappropriate or whatever. But Tourette's can also be facial tics, like if you grimace a little bit, or it can be in your limbs. There's a whole range of things that Tourette's can be, but it's a neurological thing. So you want to see a neurologist. And the speech therapist may work with that person in conjunction with the neurologist to help, like, work through, okay, if this happens, like, what do we do in that case? What's our workaround? But because the underlying thing is that neurological piece, you really, really want to have the neurologist on board.
Because you're talking about the media making fun of it. South Park did an episode on Tourette's, but the actual the organization that for Tourette's actually applauded them because they said they actually did a good job of showing what the actual disorder is. Yeah. And they weren't really making fun of the disorder. They were making fun of Cartman being an asshole.
Yeah, exactly.
That episode's like, they were just making fun of him trying to be manipulative by saying they had Tourette's.
Exactly. I know the episode you're talking about, yeah.
But yeah, I remember reading about that. It's like, the Tourette's community's like, they did a good job.
Yeah.
It wasn't...
Thanks, South Park, for representing. Yeah.
They usually do a good job with, like, topics like that.
Yeah, they do, yeah.
What advice would you give to people who have an employee that has a speech impediment, or have a child or a family member, friend?
Ooh, excellent question. For people who have employees, there's a big law that you have to be aware of. The ADA, Americans with Disabilities Act.
Mm-hmm.
That was passed in the 90s. And basically that states that if you have a disability, physical, speech, cognitive, otherwise, that there are accommodations and modifications in place within reason that you hire this person and let them do the job.
Mm-hmm.
So, okay, obviously if I want to be an NFL player and I do not have legs, that's probably not going to happen because that's not a reasonable accommodation. But let's say that, you are somebody who stutters and you have to give the occasional presentation at work. You can work with your boss to say, this is something that's going on with me, and take charge as an advocate for yourself to talk with them how you're comfortable.
Mm-hmm.
And to make sure that you use the ADA to your best ability to make sure that your job is protected, that you're not being discriminated against, and then the employer to be aware that, it's not that they're stupid, it's not that they're lazy, and here's how you can help them with these resources. And, ASHA is a great resource on their website. ASHA is the American Speech Language Hearing Association.
Oh.
That's our big, overarching guide of who controls SLPs and does the research and brings us all together. So they have a lot of good resources. And, because people don't know what speech therapists do so much, they don't know what the disorders are. So when an employee comes in and has anything different, they just don't know what that means. So I think it would just be about educating yourself. So as the employee, advocate what's going on with you. As the employer, be open to that and research yourself.
Be sympathetic too.
Yeah, exactly.
What about someone with a child? Like they're starting to hear him stutter really badly. What advice would you give to them?
If you have a kid with a disability, I always try to be very empathetic to, there's going to be that moment of grief that parents have where they realize that their kid is not what they expected it would be. And that's okay. Sometimes you have really emotional interactions with parents where they break down. You end up being sometimes like a psychological therapist where they need to just cry that day. Or the therapy session turns into them talking about why having a kid with autism is hard. And that's okay. So what I would say to families who are working with kids who have any special needs, speech and language or otherwise, is that make sure you have a good support network. Don't do it alone because there is going to be burnout. You're going to get tired. You're going to get frustrated. Do your research. Know what it is that your kid is dealing with. So that you have a good network of doctors and all that, to the best of your ability what to expect, and take care of yourself. Have good self-care where you have me time and you take a break from being the caretaker sometimes, because caretaker burnout is crazy. Yeah. And that's even for people who have a loved one with dementia or a stroke too, not just kids.
Yeah, it's my mom does it for an older couple. It's a tough job. Really is. It's a rough job.
Yeah, we don't give enough credit to people who are taking care of others who have needs. And sometimes I think people in our society who have extra needs just kind of get cast into the shadows.
Or sometimes they're afraid to ask for help and they have to handle it on their own or hide it in some way.
Yeah.
And anybody that's out there listening, it doesn't have to be like that.
Yeah. There's a lot of good resources.
Yeah, and the people that look down on you, fuck them.
Yeah.
It's they're not people who look down on another person because of a disability or a problem someone has is not a good person.
That's more
Basically,
a reflection of them than it is about you.
Yep. What would be kind of like can you give us an example of like the worst case you had without giving away patient confidentiality?
Sure. Worst case I've had. I mean, I've had some ones where they were gross, like a burn victim, or, and I'm not really that squeamish. You have ones that are more shocking. I think the one that's stuck with me the most is, I was working in a school, and we were going on a field trip, just like walking to the store. Mm-hmm. And so sometimes you do a push-in model as a speech therapist instead of taking the student out of their school day into like, here's therapy time. You kind of go with them and try and build it into their day. So I went on the field trip with them, and I'm walking along with the kids, and this is a like high school age group of kids with autism. And this one kid decides that he doesn't want to be a part of the group, and he bolts. And this elopement behavior is like not atypical for kids with.
What's elopement?
Elopement's like running away.
Okay.
Like just I gotta get out of here. I'm gone. And it happens for a variety of reasons, like, you know, overstimulation, or I want to see what's over here, or whatever. So he does that. Obviously, that's a safety issue, right? We're out on a street, so I'm like, okay, I'm running. So I drop whatever I'm holding and I run after him. He is bigger than me because he's a teenager. And it's just me and him now because the rest of the group is behind. And, you know, I say, like, stop, no. And this kid has been known to be aggressive to staff before. He's never done it to me. So I feel pretty confident that he's not going to do anything to me. He does try and go for my arm to bite it, but I like ninja kung fu out of it. And I'm like, okay, we're done with that. No, we are going back to this place. And then he takes his iPad, which was his communication device. So it's in this really like hardcore, thick...
military grade.
Yeah, like military grade case. And just chucks it like a hockey puck straight at my face.
What?
Yeah. So it hit me straight in the teeth. And then he ran. And I didn't have the capacity to run after him after that because my mouth was bleeding. And I had to have a sick day that day. It was not good.
Was this a busted lip?
It was a busted lip. I actually had to go to the dentist and make sure that my teeth hadn't broken under the gum line.
Oh my God.
It was not good. So I applaud everybody out there who works with special needs in any way. Like, it's a tough job, and you don't get the recognition that you need. And, you know, like, it's going to be tough. You need the support network. So, yep. But it's still rewarding in that, you know, you're making a huge difference in somebody's life by helping them even with incremental steps.
Yeah. And I feel not pity. I don't want to use the word pity, but I feel honestly sad for parents who actually have to, you know, not deal with someone with a severe disability, but help treat and love someone with developmental disability. When I was a police officer, I actually went to a call like that where it was actually a beautiful day. I remember we went to this nice, pretty house. The mother was upset. The father was upset. Their son had autism. So my partner went to go talk to the parents and find out what happened. Yeah. And I went to go talk to the son. He's like 15, 16, and he's sitting on the bed, and he looks so sweet. Like, he was just very quiet to himself, and I tried to talk to him, and he wasn't talking back, which is fine. Then, my partner walks into the room, and he's like, how come you showed your mommy wee-wee? Like, what? Like, basically, she called the police because the kid had, like, had a problem, like, was just walking around the house just flashing himself.
Oh, no.
And I felt like I tried not to laugh because, like, it's kind of like it's funny for me.
Sometimes you just gotta, like, look at life and go, this is ridiculous.
Yeah, it is. But, like, then we actually heard the mother out, and it was rough.
Yeah, it is.
She was talking about they don't know what to do because he's getting older, he's getting stronger.
Yeah.
I believe he had autism. I believe that was the disability he had. But he, they were worried about him, and also they were stressed out too. So most of their life revolves around him, helping get help.
Absolutely.
And I just really feel it for those parents because they're doing really just a thankless job.
Yeah.
And it's still doing with like love and compassion behind it too, but it's just a hard.
It is.
A hard thing to do.
You bring up a really good point that, like, I think something we struggle with in our services for people with disabilities, we're really good at getting the little bitty kids, and we're good at getting people who are older, like with strokes. We're not so good at getting people who are in the middle. And so that's exactly what happened with what we were talking about. That kid was getting older, and he was getting to the point where he should be getting independent at his age, but it didn't work for his needs. So what do we do with that? And then, you know, that's really interesting, you being a cop. My fiance is working and getting in law enforcement right now. Oh, cool. Yeah. And so we've had a lot of conversations about, like, what would you do if you had, you know, a person that did have a communication disability? Like, how would you handle that? And sometimes it's a safety issue, like they are harmful to themselves, they are harmful to others, or whatever. Like, you want to make sure everybody is safe, but I think what we can do is to raise that awareness of, this is what the condition is, these are things you can do to help. So even if it's just a little thing like coming to talk on a podcast and say, like, this is what speech is, so that hopefully more people hear about it and go, oh, okay, there's resources out there, I can learn more about it, so that they're not just flabbergasted when they meet somebody who has a difference.
Well, I remember the psychology professor, the one I mentioned earlier when we talked about autism. He was my last psychology professor in college. And I was really glad I got him. He was a younger guy. He was working. He loved to teach. He was just an adjunct professor. He just taught adulthood and aging class. And he worked for the Navy doing, I think, IO psychology. Cool. But he told us something that really just stuck with me for years, was that the only way to get over your biases and to stop hate is both education and exposure.
Yeah, that's absolutely true.
He said, for a good example, a racist hates a black guy. What you could teach them, like, yeah, no, black people are just like white people, Hispanics, everyone's just people with different skin colors, different cultures. Yep. But the next thing you need to do is just, you know, expose them. Like, hey, go talk to this black guy. Go hang out with him a day. Yeah. And see what happens. You're going to find out, like, oh, all that racist things that you thought about black people. Yeah. Or any bias towards any other people. You find out, like, most of it's not true.
Yeah. Here's all the things we actually have in common.
Yeah.
Yeah. We're still just people.
Yeah. And that's, like, kind of like the hope for this podcast, too. That's why I like interviewing different people from different backgrounds. And usually I try to get the people that are commonly overlooked. Just like, you may not. A good example was the episode I did on swingers.
Yeah, I saw that.
I want to do that lifestyle. This is not for me. But like, it was actually really just educational, just really eye opening to actually sit down and talk to these people, like their culture, because that is a different culture. Yeah, it's basically like a culture within a different culture. And that there's still love there. It's not nasty as I thought it was going to be. That there is kind of like honor system there. There is all of it's based on trust. Like, number one is just trust. Like, this would not work if there was no trust involved. Yeah. But it's kind of like things like that where I find it really interesting, and hopefully I can expose people to that, you know, you don't have to agree with what they do, but you shouldn't judge them either.
Yeah.
You just accept them as they are. It's like, you know what? That's their life. Mm-hmm. Do what they want. And, love them the same. Yeah. All right. We're going to go into the question part of the podcast. Okay. This is for everyone that's listening for the first time. I ask these questions to all my guests. Just like I said before, I have a lot of people on this interview that come from different mindsets, different cultures, live different lives. And I ask these questions, and these are psychological questions that's supposed to show kind of like your interpersonal self, your inner self. And I ask these questions because I want to show people that no matter what you think about the person I'm interviewing, like you may disagree with them, you're going to find something in common with them, or you can at least relate to them in a certain degree. So this is why I ask these questions. It's also a good way to like learn about people too. All right. Given the choice of anyone in the world from any time period, who would you want as a dinner guest and why?
I think normally people would want to pick somebody like famous and influential.
I had a couple people who said their great grandmother or...
Yeah, exactly. I'm going to go with my dad's dad. And I never met him. He died before I was born. And so I think it would be really interesting to meet him just to learn about, like, who he was, what kind of role he played in my dad's life and my grandmother's life and that whole family dynamic and, what that made me.
Made you.
Yeah, that whole circle.
Great. What would constitute a perfect day for you?
Let's see. Waking up when I feel my body is ready. I'm not a morning person.
I mean, I'm a night owl.
Yeah. Eating a good breakfast. Spending time with family and friends. My dog Petrie, who I adore. He's a whippet, which is like a tiny greyhound.
Really?
Oh, he's adorable.
They make tiny greyhounds?
Yeah, so like the greyhound, is like the big one.
Yeah.
The Italian greyhound is like the teeny tiny one. And then the whippet is in the middle.
I gotta look that up.
Yeah. And maybe, read a book, watch a movie, just do something laid back and go to bed whenever I feel like it. Just like a laid back day.
Just a laid back day.
Yeah, that would be a perfect day.
When was the last time you sung to yourself and to someone else? So it's kind of like a two-part question.
Yeah. I sing to myself pretty frequently. I sing little stupid songs, like I just make up things like driving in the car, this car is going fast, whatever. Or I sing to my dog all the time. I sing him little silly songs about how cute he is. And I don't know if he appreciates them, but I like to sing to him. And what was the second part of the question?
To someone else.
To someone else. Oh, I sang a silly song to my fiance the other day.
Yeah?
Yeah.
What was it?
It was a silly little song about, like, how we were like a good family and we were meant to be. Yeah. It was nice.
That's so cute. If you could change anything about the way you were raised, what would it be?
Probably, and this is about communication,
Mm-hmm.
having a more straightforward use of talking about how you feel. So, sometimes things in my immediate family were left unsaid, or just kind of got brushed under, and it built up and turned into a big thing. So, I'd rather someone say, this upset me. Can we not do that again? And really just get at it right when it happens and be open and honest with each other. Be honest with ourselves and have that open communication. That's what I would do differently.
Yeah, I'm starting to find out, like, when I ask more about my family, it seems like it was kind of like an issue with older generations, that they thought I was weak to, like, met their problems or saying, like, hey, you hurt me.
Yeah.
They just built it up and came out.
It's like a point of pride and you feel insecure.
Yeah, it's like there's some strength to that, but it's also some weakness to that too, because it is based on fear.
Mm-hmm. It is, yeah.
Yeah, because you're afraid of shame or afraid of...
Yeah.
You know, sometimes the strongest thing you could do is admit that you need help.
Absolutely. I mean, I still struggle with this. Like, I'm not always honest and say, like, that was not cool. I struggle with advocating for myself. Just say, I need this. I need help. Please stop doing that. Because I don't want to sound whiny and naggy.
Yeah,
it's
of course.
a balance, right?
Yeah.
But I want to achieve that where I can stand up for myself and say what I need, and also then respect the people that I'm with and help give them what they need to. Well,
there is she's a sociologist. I read a couple of her books, and she's made some really good points. She has a really good TED Talk. Mm-hmm. Her name is Dr. Brene Brown.
Mm. Oh, I think I've heard of her.
Yeah, she had, I think she's one of the top 10 TED Talks.
Yeah.
Well, her books are really good, and I had problems with what you said with kind of like boundary issues. Mm-hmm. And she said, like, someone that, first of all, you need to love yourself, and by loving yourself, you're allowed to say no and stand by that no.
Yep.
Or say, like, hey, I need help, and if somebody's not going to be there to help you out and reject that, and you have the right to actually... There's nothing wrong with saying, like, no, I don't want you in my life anymore.
Mm-hmm. Yeah.
But, like, her books are really... I suggest any of her books, or even the TED Talks.
I'll check that out. That's good.
If you were arrested and your family and friends were not aware of what you were charged with, what would they assume you were arrested for?
Rabble-rousing.
What's that mean? What the hell is that?
So...
What charge is that?
It's not an official charge. So I like to make things change. I like to, instead of just complaining about things and laying there and taking it, I would rather stir things up. And so, for example, I recently wrote a letter to ASHA, that organization that I talked about. Mm-hmm. And there's a lot of things in the field right now that are quite frustrating.
Like what?
Like, pay is not good. A lot of it is fueled by it being pay per service. So, it's about quantity over quality.
Oh, okay.
That kind of thing. And it happens in schools, it happens in hospitals. It's all about the bottom dollar. And another thing is that, like, there's this increase of staffing companies coming in and being a middleman to say, hey, schools and hospitals, do you need a therapist to work for you? I've found a person. And they just kind of throw a body in there. They don't care if it's the right fit or anything. And then they don't actually provide a service for either of the two sides. They just take a cut of the money. So they're taking money out of the pockets of not only the consumer, the clients, but also the clinicians. So we're watering down the service. So, there's some things going on in healthcare in general and also specifically in speech that make it difficult to be a speech therapist right now. And so I'm kind of rattling some chains right now. I wrote this letter and I got about 350 people to sign on with me.
Oh, cool.
Yeah, I published it on my website and I sent it to ASHA. And they actually responded back. Mm-hmm. They sent me like a 4-page letter. I'm still kind of digesting it and figuring out what it means, if I'm going to respond, what I'm going to respond with, that kind of thing. But, it's a weird time of transition in healthcare. I think there's, the past 10, 20 years, we've seen so many changes in pushing for more productivity and less time, and that's not really what I'm all about.
Well, unfortunately, that's going on like in different fields too.
Oh, absolutely.
I was talking to my mom yesterday. I told her, I think 10 years from now, maybe 15 or 20, we're going to look back at this age and think like, wow, this was freaking crazy. Mm-hmm.
Right.
Like we lived in a time where the pay just sucked. We're all educated.
Yeah, overeducated, underpaid.
Yeah, underpaid. And they tell, especially our generation, that we're lazy or we're spoiled.
Right.
And it's like, whoa. We work. We want work. You guys screwed us over.
I work pretty hard. I'll say that, yes.
Yeah, we want to work.
Yeah.
It's not being spoiled. It's just you guys really did screw us over.
Yeah.
This is a fun one. If you wake up tomorrow and gain any power or ability, what would it be and why?
Do-over. I could do over anything that I messed up.
But it has to be kind of like a restraint on that, though.
Yeah, there would have to be a restraint.
What would be like 30 seconds or a day?
It would be like one thing within the day. Like you have one flub in the day, fix it.
Okay. Well, that's actually a pretty good one. The first time I asked that question was to my friend. He used to be a cop, and he loves comic books. And me and him love comic books, but he loves it to like another degree. He said like the power that anything he says comes true.
Oh boy, I wouldn't know that I would want that.
He said like it's actually it's probably the most powerful superpower to have.
Yeah, true.
Well, it's like man, yeah, it's like what you said.
You gotta be careful what you say, though.
Yeah, you gotta be quiet most of the time.
Yeah, you gotta think things in your head, not say it out loud.
You have to have a translator. Okay. What, if anything, is too serious to be joked about?
My sense of humor is pretty irreverent, where I talk about a good number of things that probably shouldn't be joked about, but I draw the line on things that I think there's just a lot of deep hurt in, like genocide, for example, like something that there's not much funny in seeing a bunch of people die for no reason.
Yeah.
Yeah.
Like the Holocaust.
Exactly, yeah.
Alright. Oh, I gotta ask this question since we kind of touched on it earlier. What conspiracy theories do you believe in?
Do I believe in any conspiracy theories? I don't know that I do. Is it a conspiracy theory to think that there probably are aliens? Is that still a conspiracy theory?
I'm not sure that falls into conspiracy theories. Well, like, if you get specific with, like, Area 51...
No.
That would be, like, a conspiracy theory, but I think that's kind of, like, falls into, like, a folklore, or maybe... Because the thing is, like, aliens, like... There could be other life out there.
Exactly. I'm more of the mindset that, like, the universe is so huge.
Massive.
How could we possibly say there's nothing else out there in our limited capacity to see this little tiny bit of it?
Of course.
So I'm not going to say, no, there's nothing else. There's probably something else out there. I just don't know what it is.
Yeah.
So for conspiracies, I don't think I really have any conspiracy theories that I believe.
For the alien part, do you draw the line on, like, aliens actually visit us, or are you just saying, like, there's, like, other life out there?
I don't think aliens have visited us. I think we would have had, like, more proof of that.
Yeah. Except for, like, some drunken guy.
Yeah.
Did you guys see that? Did you see
that? I found, like, a headphone jack in my ankle or whatever. Yeah, no.
There's a headphone jack. Yep. Let's see. What is your deepest held beliefs?
Deepest held beliefs. I've been thinking about this a lot recently. I've been in kind of a reflective mood. Kind of simple. Wanting to prioritize people who are close to me, like family, friends. Doing a good job in the things that I'm passionate about, like holding myself accountable for things that I say I'm going to do. So instead of saying, I'm going to do all these million things, because I sometimes do that.
Yeah.
I really, like, I have a million ideas. Instead, like, okay, let's do a small number of things, and let's do them well. And trying to be more kind. I think I'm generally pretty kind to other people, but I am not always so kind to myself, so that is something I'm working on.
Or are you just like really just self-critical, that kind of thing?
Yeah, definitely. Yeah.
Yeah, I'm like that too.
Yeah, I'm that person who, like, late at night, you're trying to fall asleep, and in the back of your mind, you're like, hey, you remember that time in second grade that you did that thing? Ah!
Oh, remember when you made that little joke today for your boss and it wasn't funny?
Super uncomfortable. Yeah, let's remember that in excruciating detail. Exactly.
All right. Is there something you dreamed of doing for a long time and haven't done it yet? And why haven't you done it yet?
So, this is still kind of a work in progress. In building my business, I'm really refocusing it on telepractice.
Mm-hmm.
And so, telepractice is just basically, think of it like as a Skype session where, I see your face and we have a headset on and we do speech just as we would in person. It's a little bit more where we have like better platforms so that we can use some more fun things and people can't hack into it. So it's privacy, encrypted. But what I really want to do with this is, I talked to you about the things that we're struggling with in healthcare and speech specifically with this like payment model. And speech therapists aren't advocating enough for themselves and we're getting underpaid. I want to try and make a change in that in my company to offer positions for therapists that like offer a good working wage because I know what they're worth. And I want to work with schools to show them that teletherapy actually helps increase attendance rates. And it is cheaper because you don't have to have a therapist in your building. And so using technology in a good way, instead of just being gimmicky about it, but actually like researching what is the best technology that we have available to make things work. Because sometimes I see kids in Oklahoma who are in so rural areas that they would not get speech otherwise.
Oh, okay. Yeah.
So it really brings together people from all walks of life. So that's really kind of my goal right now in something that I haven't achieved that I really want to make work.
Well, you already started, so it's going to happen at some point.
Hopefully, yeah. that's the goal.
Yeah, that's the goal. What is your most treasured memory?
Most treasured memory. This is a tough one because it's been kind of a tumultuous 2 years. So I was in Chicago, and my fiance said on a lark, "Hey, what would happen if we moved to the Virgin Islands?"
What?
Yeah. And I laughed, as anybody would, and said, "You just don't want to shovel snow." Because it had just snowed, right? But then we actually did some research, and he wanted to do scuba diving, and I found a therapy position where I could build my own business and, take a little bit of the overhead off of what I was doing in Chicago, and I thought, hey, maybe this could work. It was a little slower pace. We could go do something different. We were young and foolish, and let's do it. So we sold a bunch of our stuff and, moved down to the Virgin Islands June of last year. In September of last year, Hurricane Irma happened.
Oof.
Yeah. So we weren't able to get off the island because the prices for tickets just skyrocketed. They were like $3,000 per person.
Oh my god, they price gouged?
They did. Yeah, they price gouged.
I thought that was illegal.
I thought so too, and I don't know what to do with that. So I wasn't able to get off. The weather people were like, it's coming, it's not coming, it's coming, it's not coming. The people on the island didn't think it was going to happen. So we kind of just battened down and did what we could. We were on this little tiny peninsula of the island that got the brunt of a lot of the wind. And Hurricane Irma was like the worst hurricane that the Caribbean has had in recent history. So our apartment had, it was made of stone. Like most places there are made of concrete. And it had this thick wooden door that, was probably like 5 inches thick. And that exploded open. Like
Wow.
the mechanism broke. Just like poosh. And then what we call the safe room, which was like a separate bedroom, that door actually like broke in half.
Oh
and
my
so
God.
we spent 7 hours hiding under a futon mattress, just like hoping we weren't going to die, with me, my fiance, and a dog. And so we're just happy to be like back here, alive, and with a roof over our heads.
Yeah.
We're trying to rebuild and do something new. So treasured memories for me right now are little tiny things of a chicken salad sandwich I had on the evacuation cruise ship that was a really bad sandwich, but it was the best sandwich because it was cold and I was tired and I needed food. Or like coming back home and just like stepping foot onto U.S. territory. Well, Virgin Islands is U.S. territory, but like U.S. continental soil and being like, I'm home! That kind of thing. Or, little things like just appreciating the little things in life. Like, oh, I saw a rainbow today, So I don't think I have a big... This is a treasured memory for me. I'm more about
The smaller moments.
the small things in life.
Well, it's the smaller things that make it worthwhile.
Yeah.
It's like what you said. Like yesterday, I had my birthday, and I was just happy me and my grandmother went to eat at Carrabba's because I love Italian food.
Oh,
and
yeah.
it was nice. Me and my grandma had dinner, and the manager gave me an extra sangria for my birthday.
There you go.
Yeah.
Yeah, it's
It was
little things, right?
Hey,
Spending time with family, having a sangria.
They have a cappuccino. It was nice.
Yeah,
It's like,
good
oh,
times.
this is a nice birthday. What's the biggest sacrifice you made in your life?
Bigger sacrifice I've made. It's probably not so much a physical one of like, I gave up a job or I gave up a house or anything. I think what I've neglected is focusing on taking care of my own emotional needs and taking care of other people. So I focus on taking care of other people and then not so much like my own well-being. So I don't know if that's, I don't want to be like, oh, martyr, that's a sacrifice, but
No, it's your sacrifice.
yeah, that's what I'm trying to like revert now is to love other people. Like you said, you must love yourself first. So that's a not good sacrifice that I've made.
Well, like I was just thinking about when we're done with this episode, I'm gonna give you one of the books because I already read it, so I'll let you have one.
Oh, cool.
I gotta just go to my room and get it. Okay, this is the last question, and I give this question to everyone. What is the worst thing you have ever done in your life, and what is the best thing you have ever done in your life? So it's a 2-part question.
See, I'm going through that laundry list of like going to sleep, embarrassing things. Which one is the juiciest? Worst is probably like not being there for somebody in a time of need. Like one that really sticks with me is a teacher that was really good to me. He had a son who committed suicide.
Oh.
And this was like elementary school. And my parents gave me the option to go to the funeral, and I decided not to. And I really regret that. Like, I didn't know his son, but I feel like I probably should have gone there just to be supportive. So, that's a not good one.
That's something to you, though.
Yeah. And the best one... is, I think, opening that. I did this in tandem with somebody else, that support group, the Chicago Aphasia Network. It's a kind of grassroots organization, but there wasn't anything like that in Chicago where people who had aphasia could meet and, like, chat or find resources about how do I get a bus if I am disabled. So, like, starting to get involved in the community and give back, not just because I need a paycheck, but actually being involved because I care. So starting that trend with CAN, the Chicago Aphasia Network, and, like, continuing that on, I think that's the best thing I've done.
It's a good thing that you do that too, especially because that's something I wasn't really aware of. I'm pretty sure a lot of people are not aware of aphasia and the difficulties of people have with aphasia. So, well, I want to thank you for coming on.
Absolutely.
I really did enjoy this. This is really eye-opening. Give us your website again and Chicago Aphasia Network.
Yeah, so my website is Linguabilities. So lingua, like tongue, the lingua, and abilities, like you have the ability. So linguabilities.com. And the Chicago Aphasia Network is chicagoaphasianetwork.org. If you see anything that says, like, CAN, that CAN abbreviation, that's also it. They're based in Chicago. Ellen Clark is the president, and I co-founded it with her, so she's a great resource. She can connect you to resources all around the country. There's great organizations that are not in Chicago that might help people in Florida too.
All right, great. I'll put the links in the episode description, so anyone who wants to check it out, you just go back to the description and click on it, so you guys could easily find Marissa and the Chicago Aphasia Network. It's the end of the episode. Thank you guys for listening. Again, check out the website, ataboolife.com. Free content on there. And keep tuning in. We'll keep having more episodes like this. Alright. Guys, have a great night.